When horses act out, kick, bite, refuse to cooperate, or seem unpredictably moody, the immediate reaction is often to blame training problems, dominance issues, or bad attitudes. However, groundbreaking veterinary research reveals that the vast majority of behavioral problems in horses stem from physical discomfort, pain, or physiological dysfunction rather than psychological defiance. Understanding these hidden causes transforms how we approach training challenges and reveals why traditional punishment-based methods frequently fail to resolve underlying issues. The hidden pain factor. Research from veterinary behaviorists shows that 85% of equine cases presented with problem behaviors have pain as a contributing factor. This statistic fundamentally challenges conventional thinking about horse behavior. Prey animals such as livestock and horses hide pain, as pain signals vulnerability to would-be predators. Researchers across species lines have observed that facial expression of pain often emerges before other symptoms, such as elevated HR, or changes in feeding behavior. This evolutionary adaptation means horses can experience significant discomfort for extended periods before owners recognize obvious distress signals. Pain-related behaviors often manifest as training resistance, sudden behavioral changes, or seemingly random aggressive episodes that traditional training approaches cannot address effectively. Gastric ulcers, the silent saboteur. Equine gastric ulcer syndrome affects 60 to 90% of performance horses and causes behavior changes that owners consistently misinterpret as attitude problems. Horses with an ulcer score of 3 or 4 showed a more stressed pattern of behavior and HRV indices, thus providing a potential method in determining severity of lesions without invasive procedures such as gastroscopy. Ulcer horses pawed more and ate quicker during feeding periods, behaviors typically attributed to impatience or poor manners. Reported behavioral changes include nervousness, aggression, and self-mutilation. Show horses with a nervous disposition are more likely to have gastric ulcers than are quiet horses. In one study, 92% of horses with girthiness were found to have gastric ulcers. The chronic pain from ulcers creates a constant state of discomfort that makes horses reactive, unpredictable, and seemingly uncooperative during handling and riding. Musculoskeletal pain masquerading as disobedience. Horses experiencing back pain, joint dysfunction, or muscle tension frequently present behavioral symptoms that owners interpret as stubbornness or resistance to training. Research demonstrates that horses cannot verbally communicate pain location or intensity, so they express discomfort through altered movement patterns, refusal behaviors, or defensive reactions. A horse that suddenly becomes difficult to mount may be experiencing back pain. Horses that pin their ears during grooming or tacking may have muscle soreness that makes touch uncomfortable. Refusal to pick up specific leads or difficulty with lateral movements often indicates asymmetrical pain or stiffness rather than training deficits. Professional assessment by veterinarians trained in equine sports medicine can identify these pain sources that traditional training methods cannot address. Neurological dysfunction, creating behavioral chaos. Neurological conditions in horses frequently manifest as behavioral abnormalities that appear to be training or temperament issues. Equine protozoal myeloencephalitis, EPM, cervical vertebral malformation, Wobbler syndrome, and various inflammatory brain conditions cause coordination problems, altered sensory processing, and unpredictable reactions that owners mistake for behavioral problems. Horses with neurological dysfunction may suddenly spook at familiar objects, show inconsistent performance, or display aggressive behaviors when confused or disoriented. These conditions require specialized veterinary diagnosis and cannot be resolved through conventional training approaches. Early recognition prevents dangerous situations and allows for appropriate medical intervention. Hormonal imbalances driving mood changes. Endocrine disorders significantly impact horse behavior, but remain underdiagnosed because symptoms develop gradually and mimic personality changes. Cushing's disease, PPID, causes lethargy, depression, and altered social behaviors in older horses. Thyroid dysfunction affects energy levels, learning ability, and emotional regulation. Insulin resistance creates discomfort that manifests as irritability and resistance to exercise. Reproductive hormones cause cyclical behavioral changes in mares that owners often attribute to moodiness rather than recognizing as medical conditions requiring veterinary attention. These hormonal imbalances create physiological stress that makes horses appear uncooperative or difficult when they are actually experiencing metabolic dysfunction, nutritional deficiencies affecting brain function. Dietary inadequacies directly impact neurological function and behavior in horses. Vitamin E deficiency causes muscle dysfunction and neurological symptoms that appear as coordination problems or performance issues. Magnesium deficiency creates muscle tension, anxiety, and hypersensitivity that makes horses jumpy and reactive. Inadequate protein or amino acid profiles affect neurotransmitter production, leading to mood disturbances and learning difficulties. High sugar diets cause blood glucose fluctuations that create energy spikes and crashes, resulting in unpredictable behavior patterns. Horses receiving inadequate forage develop gastric ulcers and stereotypic behaviors as they attempt to satisfy natural grazing needs. Nutritional evaluation by equine nutritionists can identify dietary causes of behavioral problems that training modifications cannot resolve. Environmental stressors, triggering behavioral responses. Physical environmental factors create chronic stress that manifests as behavioral problems. Poor air quality in barns causes respiratory irritation that makes horses uncomfortable and reactive. Excessive noise levels from machinery, traffic, or construction create constant stress responses that affect behavior and performance. Inadequate lighting disrupts circadian rhythms and affects mood regulation. Overcrowded facilities increase social stress and competition for resources. Temperature extremes without adequate shelter cause physical discomfort that influences behavioral responses. These environmental stressors accumulate over time, creating behavioral changes that appear sudden but actually result from chronic exposure to suboptimal conditions. Social isolation creating psychological dysfunction. Horses are obligate social animals whose psychological well-being depends on interaction with other horses. Social isolation causes measurable stress, hormone elevations, and behavioral abnormalities that owners interpret as personality problems. Isolated horses develop separation anxiety, depression, and aggressive behaviors when finally exposed to social situations. They may show excessive attachment to human caretakers or display inappropriate social behaviors with other horses due to limited socialization opportunities. The stress of isolation compromises immune function and affects learning ability, making isolated horses appear slow to train or difficult to handle. Providing appropriate social opportunities resolves many behavioral problems attributed to training deficiencies. Saddle fit and equipment issues. Poorly fitting tack creates pain and discomfort that horses express through resistance behaviors. Saddles that pinch, bridge, or create pressure points cause back pain that makes horses reluctant to be mounted or ridden. Ill-fitting bridles create headaches and jaw pain that manifest as head shaking, bit resistance, or general irritability. Tight girths cause abdominal discomfort that horses express through girthiness, bucking, or refusal to move forward. Professional saddle fitting and regular equipment evaluation can resolve behavioral problems that stem from equipment-related pain. Many horses labeled as difficult or dangerous are actually experiencing chronic discomfort from poorly fitting equipment. The misinterpretation of natural behaviors. Many behaviors labeled as problems actually represent normal equine responses to inappropriate management or training methods. Horses naturally move away from pressure, so pushing harder when they resist creates escalating conflict rather than compliance. Horses communicate discomfort through subtle body language that, when ignored, escalates to more dramatic behaviors. Prey animal instincts make horses cautious of new situations, yet rushed exposure creates fear responses that owners interpret as stubbornness. Understanding natural horse behavior prevents the mislabeling of normal responses as behavioral problems requiring correction. The cascade effect of unaddressed issues. When underlying physical problems remain undiagnosed, horses develop compensatory behaviors that create additional problems. A horse with back pain may alter their movement pattern to avoid discomfort, creating secondary muscle tension and joint dysfunction. Chronic pain causes stress hormone elevation that affects immune function, digestion, and mood regulation. Horses experiencing discomfort become hypervigilant and reactive, making them more difficult to handle and increasing the likelihood of accidents or injuries. Early recognition and treatment of physical problems prevents the development of secondary behavioral issues that become increasingly difficult to resolve over time. The training trap. Traditional training methods that focus on behavioral modification without addressing underlying causes often worsen problems rather than resolving them. Punishment-based approaches increase stress hormone levels in horses already experiencing physical discomfort, creating fear and anxiety that compound existing problems. Forced compliance through dominance-based methods suppresses communication about pain or discomfort, allowing underlying conditions to worsen. Horses that appear to improve under harsh training methods often show behavioral rebound when the pressure is removed, indicating that underlying causes were never addressed. Effective training requires identifying and resolving physical causes before implementing behavioral interventions. The key to resolving horse behavioral problems lies in comprehensive evaluation that considers physical health, environmental factors, and management practices before attributing issues to training deficits or personality problems. This approach requires collaboration between veterinarians, equine nutritionists, saddle fitters, and experienced trainers who understand the complex interplay between physical comfort and behavioral expression in horses.